Yes, hi, is everyone ready? Hello, everyone. Thank you so much for joining us tonight for another Deaf Health Talk. I am very happy to introduce our presenter this evening. His name is Zach Ennis, and this is his sign name. And he is here to discuss food insecurity. So he'll be talking a little bit about what that means. And he has established the Rochester Deaf Kitchen here in Rochester, and I'm sure that he will elaborate on that as well. So Zach, welcome. Yes, hello everyone. Should I go ahead and start? Jason says, yep, go ahead. Yes, thank you so much for that wonderful introduction. I am so thrilled to be here today. And not this morning, this evening, my bad. And today I'm going to be discussing food insecurity. Really, food insecurity. Often people don't really know what that means. The concept of it is a little bit complex. And it doesn't necessarily mean that there's not enough food, but it has multiple meanings. So tonight I'll be talking about the multiple meanings of food insecurity. I will be touching on several different topics tonight, but you have to remember one thing this evening, and that is the concept of access to healthy and nutritious food. Does it mean that we need any food or always the same types of food? But it means if you have access to nutritious, healthy, and a variety of food. And that is a different concept of having not enough choices or eating the same foods all the time. So I am looking forward to seeing what ideas you have about this topic tonight. Tonight I will be discussing several topics listed on this slide. The first one is food insecurity. I'll be expanding on what that means. I will also be discussing specific challenges to the deaf community and how challenges in the deaf community can lead to food insecurity and how food insecurity leads to other challenges that deaf people face. I will also be discussing the term dorsality. And lastly, I'll be discussing our program, the Deaf Community Food Pantry, which is under Rochester Deaf Kitchen. And those are all the things we'll be discussing tonight. And something I want to highlight that I have not done yet is sharing 4 personal stories. And these are real stories of real people. I have modified the names and changed some of the basic information in order to protect people's confidential information, but the stories themselves are real. There are some details that are confidential that I won't be sharing, and as a deaf person, I hope that the details are, if you know who the people are, that you keep that confidential. So these are personal stories and about food insecurity and people's actual lived experiences with this topic. We talk about hunger and food insecurity as if they're overlapping topics, but really they're 2 different concepts. Hunger is a personal experience. It means maybe you haven't eaten all day and your stomach is rumbling and you feel hungry. You eat and then you feel satisfied. Food insecurity is a more abstract systemic concept. Food insecurity is more of an abstract systemic issue, and it's not just solved by giving someone food for one day and then they're set and their problem is solved. No, absolutely not, because the next day they're still going to be experiencing food insecurity. So that's why it's more of a systemic issue. And our pantry is here to confront both of these issues. Oh, thank you. Thank you for telling me that. Food insecurity. I want you to imagine sitting at a long table full of people. Imagine you have different types of soup. And you're sitting at this table, and maybe you don't know what to do with all of the utensils. There are a lot of different types of plates. There are a lot of people gathered around, and servers are bringing out different rounds of food. There's steak, there's salmon, big piles of food. And some people have a lot, and some people don't have enough. So imagine what would happen if all of these people are sitting at this table and they see that not everyone has equal servings. Maybe you get some plates to share and split it up equally, hopefully, because some people only have very small servings. But someone that has a very small serving of food doesn't have enough to share with everyone else. You thank your friends that have shared, the dinner is over, and tomorrow morning, all of these people show up again. You see all of your friends again, and you're not sure if you're going to have enough food or if it's going to be the same situation as last night. You have no control over that. So that's why food insecurity really affects people's lives. It's not just a one-day problem. It's, do I have access to food for tomorrow and the next day and the day after that? And it can be something that's out of your control. And that is what I want you to imagine as an example of food insecurity. In the deaf community, we have many things that are out of our control. Maybe we want to apply for a job and someone won't hire us because we're deaf. So we might be on limited income. And that impacts our anxiety in other areas of our life. It could impact our ability to afford food. That's different than hunger. Hunger is a personal experience. It means I am hungry right now. Rich people are able to secure food every day, and that's why there's a difference between hunger and food insecurity. Another important topic that I want you to be able to differentiate is food poverty and food shortage. And this might be some new vocabulary that you're learning tonight, and I'm here to help you parse out what the different definitions are for each of these topics. Food poverty means right now you don't have food and you cannot access food. Either you can't afford it and you can see that there's plenty of food around, but the problem is that you are not able to obtain it. It's like you are on a busy train going past a grocery store and you don't have time to stop and get that food. You don't have access to it. That is food poverty. A food shortage is different. A food shortage means maybe there's a war. Think of Ukraine right now. There's a war going on, and several of the crops have been destroyed. So that means that they cannot produce the food products that they're used to making. That's a food shortage. Because it's not because of people's ability to afford the food or not, it's just that there are not enough resources available. So that's important for you to be able to differentiate.
So I just explained about that. We'll get into Sasha's story next. So food insecurity is a heavy topic. Several people have come to our food pantry. We're opened about 3 months ago and we supply different free foods to the deaf community. We don't ask or demand any information or ID from these people. We don't collect their income, and I'll explain why in a little bit. But we do have several people that come to our food pantry because they know that all the volunteers sign and they're able to access the information there. And we're also very warm and welcoming. Many people that come receive food, and many of them are immigrants who have moved to America from different countries and are still getting on their feet. English might be their fourth or fifth language. It's not even their first or second. It might be further down the line than that. So it's completely overwhelming. Um, Having ASL, learning English and American culture is really challenging for a lot of people who are immigrants. Coming into a grocery store may be overwhelming because many of the labels are in English. So we try to use pictorial labels to help people identify what the food is so they don't feel as lost. Oftentimes, they'll come to us and ask about the food, and we'll explain it in American Sign Language or gestures so that they can understand what this food is for and how to cook it. We're just there to serve deaf people. Food insecurity includes eliminating barriers to understanding as well. Um, Teaching people how to cook things that they don't know how to. That definitely contributes to food insecurity as well, feeling like you can't cook the food that is available to you. We have a variety of different kinds of foods, and we also give people the confidence to try different foods. Maybe, if somebody can't afford a lot of food, but they also can't afford or they don't know how to prepare the types of foods that they can afford, we try to teach them how to do that so that they're able to access that food. And I'll be sharing a bit more about that tonight. Now, food insecurity, there are some signs that you can see. I mean, like I mentioned, it's a very abstract concept, and sometimes it's hard to identify what food insecurity is or who is food insecure. It's really easy to overlook when we go about our day-to-day lives. It's very difficult to distinguish who's food insecure and who's not. But there are some signs that could give you a little bit of a hint. This isn't a recipe for 100% success of identifying a person who's food insecure, but it might give you some ideas. If you notice that somebody um, has a habit of eating a certain type of food, like for example, rice, maybe they used to eat a variety of foods and now they only eat rice, that's a good sign. Also, if they're skipping meals, if they decide to, not have lunch or skip breakfast, that could be a sign of intermittent food insecurity. Maybe it's that they don't have any option, or maybe it's that they're trying to save money. That could be a sign of food insecurity as well. Another possibility is starting to complain about things like physical ailments such as headaches or stomach aches or having a hard time digesting things, heading back and forth to the bathroom several times. Many people, like I mentioned, can get different medical conditions because of food insecurity, because they might be eating the same type of food over and over again and not getting the nutrition they need. There are some physical signs that could be food insecure, and that could mean someone is food insecure. And if you ignore a headache long enough, it can become chronic and get worse. Another example is a person who says something like, "Oh, this is delicious," and they portion their food so that they could save some for tomorrow, and they're like, "Oh, I'm taking this home with me." That might be that they're frugal, that they were trying to save money, or maybe that they're trying to budget their meals so that they can get several meals out of one portion. They might also eat very small portions and take a huge portion home. So that could be a sign of someone having food insecurity. The last um, is if you've noticed someone is gaining a lot of weight or losing a lot of weight. I know typically if you think about a person who's food insecure, you think that that means they have no food, but that's actually not always the case. Maybe, for example, they go to a bulk food store and buy the same bulk food every time, huge boxes of pasta or rice, and those heavy carbs cause you to gain weight. Um, Also, any drastic physical changes, that could be a sign of food insecurity as well. Our program has several, varieties of people that come in, and we do notice some things about them. We have two distinct groups, people who are struggling to access food, that we call chronic or persistent food insecurity. It's typically the label we give that. And then there's transient food insecurity. People who are in the chronic group are fairly few in number. Most people are transient food insecure, which is interesting. People who are chronic means that today they're worried about where they're going to eat, what they're going to eat. Tomorrow they're not guaranteed to eat anything, so they might be saving portions for tomorrow. And that's a very small group of people, and they're in a very serious situation. The other form of person is transient, which means, they might have a job and then all of a sudden they get laid off. That's a temporary thing that, they've lost their income. Or perhaps someone in their family becomes very ill, or they become very ill and end up in the hospital. It's not something that will last forever, but it puts them in a temporary food insecure situation. So that's what we define as transient. Many deaf people that we meet don't have jobs, and if they do, they don't make a great living. They might have a limited income or rely on SSI or SSDI. So they budget their very little paychecks to last as long as possible, living paycheck from paycheck, paycheck to paycheck. Um, and when that happens, when it runs out, what are they supposed to do? That's kind of most of the population we serve. You know how bills, rent, car payments, utilities, those must be paid, of course. And if they're late, you could get your electricity turned off or your car repossessed. It's very strict. Whereas food, on the other hand, if you can't afford it, what do you do? Usually people will prioritize paying bills first, and then food, they can come to our program. So a lot of people who are in that situation, in having a hard time making ends meet, will come to our program for food. One very good friend of mine, I have a memory with them from a while ago. Um, they were trying to decide if they were going to buy something or um, a product or buy food. And that actually means that they are food insecure. And I encourage anybody who's experiencing any sort of food insecurity to come and take advantage of our program. And I just covered these two things recently. Now I'll talk about Barbara's story, and it's a very tough story to hear, very heartbreaking. And please, to share this story, I just really feel for Barbara. She was retired, and she was following all the rules. She never got a ticket. She was a good student in school. She was doing great. She went to college. Was very motivated to finish college. She worked. She never missed work. She showed up every day. She saved money. She was doing, by definition, everything right. And once she retired, she wasn't rich, but she thought, I have enough in my budget to retire. And then Barbara became very sick. She spent a few months in the hospital, and hospitals are not cheap. They're so expensive to afford any sort of medical treatment on a long-term basis. Um, and they have hidden costs of going to the hospitals too. Things get added like, parking charges or adding hidden costs that nobody thinks of. So she lost a lot of money in that, and all of her savings was gone. And so she was in a very difficult situation, very stuck. So she's come to our program, and, she mentioned that she was very embarrassed because I'm a responsible person. She said, I've planned, I should be okay, but things are out of my control and I'm stuck. So now she uses our program, and, I hope that embarrassment eases, and hopefully that'll pass with time. Because really, food insecurity isn't our fault. It's no singular person's fault. And we just need to be there for each other and support each other. It's a tough story to share because some people, um, will understand uh, that, even that they follow all the rules, you can end up in a situation of food insecurity, and it's very scary for people to hear. Food insecurity has many different health impacts. Um, Malnutrition, diabetes, heart disease. There are many things that overlap with food insecurity. Not having a variety of fruits and vegetables and grains and only eating one thing or skipping meals and not eating anything, it can statistically, it's proven to cause physical illness, even within children. Some children, are not fed well growing up, and their development for life is behind. So, nutrition and dietary nutrition is a very serious topic, and it's important, uh, you know, that people feel full. And having enough food in your stomach and having quality food in your stomach is so important. Many people don't get the nutrition they need even if they are eating. So our program offers several different varieties of food, and we really strive to provide a variety to everybody, um, to people who are suffering from malnutrition or food insecurity. Different research has proven time and time again that food, um, either terrible quality food or unpredictable quantities of food, can cause people to really ruminate on their food situation. Academic performance might be impacted, sports might be impacted, grades, um, just all sorts of learning is impacted when people are distracted by their food insecurity. If food is taken care of, then you don't have to worry about that trauma that comes along with being food insecure. That's one really interesting thing. Uh, it really impacts mental health as well. Stress and anxiety can be associated with food insecurity. That's something that I actually really thought about for myself as an adult. Now I open the refrigerator and I look and I see I have plenty of food. I have enough for today, for tomorrow, I'm gonna be okay. Um, I feel like I kind of made it. I've budgeted, I've bought the foods that I like, and my trauma that I experienced in the past really makes me open that fridge and see a ton of food in there and think, I'm just gonna wait. I'm just gonna hold off on this and I'll eat it tomorrow. It'll be okay tomorrow. I'll put it off. But I could in actuality make more. It's a lot of work that's involved to reframing the mental stress that comes along with food insecurity and moving into a healthier mindset. A lot of people have food-driven anxiety, and they'll often choose sugary foods like soda or candy or things like that. And sugar can actually contribute to high levels of anxiety. Um, if you got one of those huge portions of a bag of chips, that's $6, and then a tiny bag of apples is $9. So a lot of people think that the larger bag is better, and that's something that's very difficult to hash out in your mind. And that really helped me kind of look into myself and learn about myself as well. And maybe you'll learn a little bit about yourself tonight too. Financial strain, that is, the scarcity of money, and we all are aware of that. And a lot of people say, "Oh no, I budget. I save money. I don't go out. I don't, you know, um, buy food at restaurants." Sometimes financial strain causes food insecurity, and food insecurity feeds into financial strain. So they're really interconnected. So if I'm saying that like I'm gonna save money, maybe I'll prioritize buying junk food because it's cheap. And then, 2, 3 weeks later, I'm still buying junk food and it causes me to get sick. And now I need to take Advil every day, or I need to take Pepto-Bismol every day to keep my stomach settled. That's a added cost. I mean, you're already scarce on the amount of food you have, but now you're also, having to go to the doctor, which is not cheap as well. Or maybe worst case scenario, You might end up in the emergency room, which is a huge expense. You know, it's really a spiral that a lot of people fall into, just a really unfortunate downward spiral.
And that
So,
topic that we don't directly talk about enough in the deaf community, that is a very important topic, is the concept of social isolation. And food is really related to socializing a lot. So many people have started to, maybe withdraw because they don't have enough money to go out. Maybe they start to withdraw from the community because they can't afford to socialize. Maybe they go out to the deaf clubs or they go out to their usual groups and they think, well, I can't make it there. I can't afford a bus ticket. I don't have a car. I'm food insecure. And so the food insecurity leads into people's ability to participate in social functions. Maybe people feel embarrassed or they actually can't afford it. And the deaf community already has several issues and challenges. And getting together and having deaf events is part of our stress relief. It's something that we should be participating in. And it's a serious problem. It's not just affecting those people individually, it's affecting all of us as a community. So maybe people that experience food insecurity think that it's only their problem, but it's not. It's everyone's problem. If there is a town full of people that can't afford necessities, they can't go out shopping, they can't pay their bills, they can't have investments, then that affects the local economy significantly. And we are already in a negative economy right now. And there are people that are rallying and protesting about the cost of things. If we think about December, about Christmas and holiday activities, how is that going to impact our ability to participate in events if people just cannot afford those types of things anymore? Now I'm going to talk about a third person who's actually quite young. They had just graduated college, got her first job, had gone on several interviews, and after a couple of attempts where they were denied, they finally got a job. And then something happened. The income that this person had, April, the income was actually very small. And it was low enough that they qualified for food stamps. So having a little bit of income, not being able to afford food and still being on food stamps, it's the balance of figuring out, okay, if I work more hours, then I might lose my benefits, but if I work fewer hours, then I get to keep my benefits, and that's something a lot of people face. So we have several different types of people that come to our food pantry, and I think many of us can relate to that experience. Having SSI or SSDI, getting just a little bit more money, and then thinking about what that would mean in terms of how it would impact the benefits that we receive. And this is just something that I wanted to add quickly. This is the prevalence of food insecurity in different states across the US. This is a study that was just published back in 2022. And it talks about the severity of food insecurity across states. Look at Texas, Alabama, Arkansas. They are dark, dark orange. And the states that are lighter yellow have lower rates of food insecurity. Usually big metro cities tend to have higher rates of food insecurity. And, a lot of people might look at this and think, oh, some states are struggling more than others, or hearing people are struggling more than deaf people. So I'm curious what it would look like if we compared deaf and hearing food insecurities across states. And this is the same study that was published from Feeding America. And it said 69% of people had to choose between their food and paying their utilities. And this includes everyone, deaf and hearing people. So with the amount of money they had two choices: to pay their utility bills or to pay for food. 67% of people had to choose between food and transportation. Now that is a tough choice to make, because you might need a car to go buy food, or you need a car to go to work. 66% of people had to choose between food or medical care. That's more than half. 57% of people had to choose between food and housing, paying their rent, paying their mortgage. So looking across all of these challenges, now these are statistics for the general population, including hearing people. Now with that same study, many of us might be thinking, okay, well, how can I save money? And this was really surprising to me. A lot of people decide to go with buying inexpensive and healthy food or unhealthy food. They think, I can't afford fruits and vegetables, I'm not going to buy that stuff. 53% of people received help from their friends or family. Well, think about people that don't have that support, that might not have that kind of community. 40% of people add water down their food or drinks to stretch it out, make it last longer. That's interesting. I didn't realize that that could be a sign of food insecurity as well. So we see these statistics up here, and we can imagine the types of decisions that people are making every day. This story that I'm going to talk about, this is a person that also came to our food pantry. And this is a person that had chronic illness, meaning they couldn't eat that much because they had trouble digesting food. They had frequent doctor's visits, and the doctor said, if you just follow this regimen and take this medication, you'll be fine. But Clinton didn't realize that that medication was addictive. So he then struggled with addiction, which wasn't his fault, but he lost a lot of support. He lost a lot of friends, lost a lot of his community, and finally made progress, got back on track. And he did not have access to other food pantries because his stomach could not digest some of the foods that were offered there. And sometimes as a deaf person, those places can be very crowded. It can be a little bit chaotic. It can be hard to communicate. So he came to us, where our volunteers sign, and we were able to understand each other, and we were able to make suggestions based on his dietary restrictions. And he had direct communication, was able to understand us, didn't have to stand in line, didn't have to deal with that commotion. So he is someone that was very grateful for our program and was able to get food that he can eat. So I've talked about several topics so far, and now I want to talk about specifically the deaf community. We know that the deaf community has many challenges: interpreters, education. We already know these things, and we've touched on several of them so far. And we as a community are really stuck in many ways, and we struggle in many ways. This is just a straight fact, a statistic that 46% of deaf people are unemployed. And that's just reality. So it can be difficult. And we have to think about how to interrupt this cycle. 46% of deaf people. We know that there are several barriers to education, but now I want to talk about politics. In the US, there are 519,682 elected officials, including federal, state, and local politics, president, Congress, governors, mayor, local officials in your city, all over the US. 519,000, a little bit more than that. Can you name any deaf elected officials? I was thinking and thinking and thinking. It should be proportional to the population that they serve. I don't know exactly how many deaf people there are in the US, maybe about 34,000. We know that that can be conflated with people with hearing loss compared with people that sign. So we don't have an exact number on that data. Maybe imagine it's 500,000. How many elected representatives should we have in government making decisions for us and representing us? There's a lot of miscommunication because of the lack of deaf politicians. So our taxes support our representatives, but we don't actually have any deaf representatives. You know that famous saying, taxation without representation? Well, I think that that applies to us because we do not have any specific deaf people in politics that have voting power with the deaf community's interest. So we pay taxes, but our specific interests as the deaf community are not represented in politics. So I think that that's something that we need to address as a community. Now, I know that we talk about education improving, and maybe that's true, but look at these statistics. I honestly could lose sleep reading these statistics. So looking at 2013 and 2018, surveying different groups, deaf, hearing, thinking about people that don't have any jobs or don't have degrees.
And
And
this
this,
isn't just in the this isn't just in the local area, you know, this is somewhere that is excuse me, that is in the local area. This is in Rochester. As you see here, there's only a certain percentage that made over 75,000, and hearing people are way ahead of that. Um, you know, it shows the disparity between deaf and hearing incomes very clearly. And I don't think that it's the only problem that we face. There's a litany of different problems with education, with other things. You know, maybe you have a great education, but you're still not hired into a job that makes you a good living. The ADA, you know, when it was instilled, it was great. I think it was like I was born several months before the ADA. So I grew up with the ADA. I aged as it did. You know, and my parents always talked about the experiences that they had before the ADA, and afterwards it's oh so much better, which I'm, you know, certain that it is. Public spaces are accessible with interpreters, things like that. But A lot of deaf people still can't access jobs, still won't be hired for a position, still can't establish a business. If they want to host events and there's only hearing people there, who's responsible to pay for the interpreter? Probably the deaf business owner. And so their employees, you might say, oh, you need to pay for their interpreter. But they're if you become a deaf employer, then you're the one that has to pay for it. So deaf people are already behind, and that just is another thing that adds layers. And relying on interpreters is a challenge. Um, ADA has some limitations as well. It's a gold chain with a what's it called? A ball and chain. Yeah, okay, thank you. A ball and chain. Uh, it's gold, it's nice, which, is wonderful. Um, but it's still a chain. So if you make changes to it, you lose that gold ball and chain, but how do we release ourselves from that? The Rochester community is more educated and still systemically they're not preferred to equivalent person who's hearing. Another study here, which was 42% of deaf people are worried about access to food. This another thing that we've seen as well, 46% don't have a job and 42 are worried about food. I feel like those two numbers must have something to do with each other. Now, again, we don't know exactly how many deaf people there are. People who sign, people who use their voice and are oral, things like that is kind of murkies the waters. But there was a study that figured out that there's about 40,000 living in the Rochester area, deaf people, 40,000. And now 42%, if you do that math, it adds to 17,000. So that's just what we know. We definitely need more studies and more analysis done. And what we can infer is that there's probably about 17,000 deaf people in Rochester who are food insecure, which really means, anytime you go to a deaf event, the next time you go to the Rochester, deaf events, uh, people there are probably worried about their food, and that's not a great feeling to have when you're looking at people who are in your community. So that story, if you, um, Michigan is a person from Michigan might tell the story better. And if you're from Michigan and you don't like how I tell the story, I apologize. I know it's your story because you're from Michigan, but the Michigan School for the Deaf, I was told, and I was told the story was that in the 1940s, students in the dorms at the deaf school were in the dorm all day and saw the facilities team putting in new trees outside. And they were curious about the planting of the trees. And into the night, uh, these deaf children decided to get out of the window to dig up the tree, the new little tree that had just been planted. They pulled it out of the ground and they turned it over and put it upside down. It's just a cute little prank that kids sometimes do. But oops, a couple weeks later, nobody said anything about anything. And it was like nobody noticed. And the roots in the soil and the dirt, the rain finally washed them away. And the tree kept growing. It was still alive. And it put out new growth and grew and grew and grew into an entire tree. And since the 40s, that story has become a famous story for the deaf community. Uh, to be honest, if you drove past, you wouldn't know that that was the tree that was in the story. Maybe you can see in this picture that the roots kind of became a tree. So I think that's a really cool story, and it's also parallel with deaf people's willingness to confront things that are barriers to them. the things that we experience, really build on top of each other, but we still persevere. We still get together, we still have our jobs, we still have our beautiful sign language and our history and our stories that we treasure still, even though we're stuck in a world that has buried us, we still grow upwards towards the sun. And I think that's a really great analogy. So several years later, went back and remembered the first time I had saw the tree. So I went back to see it again recently. And I looked over the tree and I was thinking about how cool it was and how beautiful it was. And right next to the tree on the smaller side, that a tree that was planted at the same time, I'm assuming was planted around the same time, was taller, triple the size of this little tree. So that means that the tree, if it had never been turned around, would probably be triple the size it was right now. Do we want to, um, why can't we thrive? We should be like the big tree. Why can't we thrive? So I think it's important to, you know, be inspired by that and realize that we still can. But the goal is so that the community can work together and thrive. We really want to all grow into the taller trees that were there. Now I want to touch on the word dorsality. I'm curious if you know that word. Here in the community, the program that we're at, the pantry, the Deaf Food Kitchen, there are many food pantries out there, several of them, tons, mostly run by hearing people. We're the only deaf pantry out there. We have some like at RIT has their small food share program that deaf people may use. Gallaudet has a small pantry on the campus there. So I've heard, tellings of a small food pantries, but this is the first one that I know of that's of the scale we're at. And if you know of another one, please let me know. I'd love to network with them. Because right now we're really limited. We just have the hearing model. There's no deaf model of how to run a food pantry. So I'm really hoping to be able to think of a way that's sort of the deaf way that we can make, our deafness be of value and that we can show our values as a deaf community and that we can plan a program that's something new, and to meet everybody's needs. I think that's the most important goal that we have. So I coined the term dorsality, which will start there. The goal is to meet everybody's deaf community values. And the word dorsal, that word usually here with like a dorsal fin on a shark, the one that sticks out of the water. I hate sharks. I won't go to the beach for that reason. I don't like sharks, but I'll sit on the beach and, check them out. So dorsal is that fin that's on the top. Dorsal means in the back of something. So if you're walking, behind a rock, and you're passing it, and you look underneath the rock, maybe you see something like a bug or a worm on there. It means the back of something. It doesn't mean something bad. It could be something good. And now the deaf experience. What does this have to do with that? Deaf people typically walk together next to each other. And we're really good at navigating as we're speaking to each other while we're walking. Typically, we'll be signing away, and the person who's looking at me, they can't look straight ahead. They have to kind of check in ahead of us and check into me. So they have to be aware that I'm going to be telling them something is ahead of us so they don't trip. So I'm watching where we're going as we're signing along. And we automatically take responsibility to point things like barriers out to people. If I just ignored that sort of cultural thing, the person would trip. So we watch out for each other just naturally as deaf people. If you're walking next to each other and signing, typically we do this sort of swaying back and forth along the path. We move together. That's kind of like our relationship. It's like architecture, planning, the size of the streets and that's really a lot more to it, and how we interact with each other, how we can meet the gaze of another deaf person, how one of us can look at the same time as we're walking, and we can act in faith, and we trust that other person will take care of me. While at the same time, they trust me to take care of them. It's a two-way street. They got your back, basically. That's the concept. We got each other. We take care of each other. At a restaurant, when we sit across from each other, we have the same thing happen. If something happens behind us, the person who can see it will point it out. We have hearing people have a 360 auditory field, whereas deaf people only have our limited visual field. Anyway, the point is that we developed a program that basically we are watching each other's back. We're helping each other, and it's not to make me a hero. I'm sure that if given the chance, you would help me too. You'll pay it forward. And we'll be back to allowing people, having people participate in community events to grow the community and build upon each other. It's not just me handing things out. It's really a two-way street, just like while we're walking next to each other. And if someone comes here, we want them to feel welcome and know that we don't think any less of them for showing up to our pantry. So I think this is the most fun part. At the very end, I have pictures that I'm going to share with you all. Here they are. That's our food pantry. Um, you know, Food scarcity is a really difficult topic. Plus the deaf community is even further impacted by it. But I hope that this kind of is a step for many of you to help me in our fight to face these problems that the deaf community faces every day. Okay, so the pantry, we're open twice a week, and we opened exactly 3 months ago on August 30th. Now it's November 30th. So we're open every Wednesday and Sunday, and Wednesdays are typically 9 to 11, Sundays 1 to 4. And it's on the RSD Rochester Institute for the Deaf campus. I'll show you a quick video to show you how to get there if you want to come. I think it's important that you use this entrance onto campus near the soccer field. We don't want to interrupt the school. They're really being great allowing us to use the space on campus. So we want to make sure that we're not interrupting any classes or anything. So I'm just going to show you exactly how to get in there. Here's the field. Park right there, and then get out of your car and walk up to that door. So that's where our pantry is. We're still a new program, like I've mentioned, but we've had a lot of exciting things happen so far. Again, every Wednesday and Sunday. Other days, we're not there, so we prefer that you come during those times. And like I mentioned, we want to say thank you to RSD for allowing us to use the space there. So every Wednesday and Sunday now, the amount of food that is brought in is ordered in collaboration with FoodLink, and they bring a whole block for us. Looks like this, and we put orders in, and they bring it in a truck and unload it on pallets. We really love this picture here because it shows our wonderful volunteers next to all the food, and it's taller than our volunteer there, which is really cool. The banana boxes don't only have bananas, they have several different kinds of food there, but they really like to use the boxes because they're nice and sturdy and are able to be moved back and forth really easily.
Now here are different volunteers. We got together for a group picture. And we really rely on the community to support us because we are still new. We have a lot of people making small donations, and that way we are able to provide a lot of food. We've served over 18,000 pounds of food so far in the past 3 months, and that's thanks to the generosity of everyone that has helped us so far. Having the community really makes a big difference. And this is a freezer full of chicken. Full of chicken. There were 580 of them, and each of them was 5 pounds. And we gave out 580 of them in November. And it's probably been well over 1,000. And, during Thanksgiving and Christmas time, the holidays, there are more people that come to see us. We also gave out over 120 chickens to RSD staff as well, just as a thank you. Chicken, fruits, vegetables, grains. We gave a lot of food to Deaf Refugee Advocacy, which is one organization in Rochester. They have many families that use our support. We also collaborate with Deaf Ignite, which is located as part of the Willow Domestic Violence Center, where we are able to support deaf domestic violence survivors. So those are just some other agencies that we collaborate with. We certainly are not working alone. We are a collaborative effort. And again, we've served a total of 18,800 pounds of food. And we have passed the previous goal of 14 or 15,000. So I really want to thank our volunteers for helping us with all of this work. Wednesdays were only open for 2 hours. Sundays were open for 3 hours. So we've had a total number of hours of open time we've been open for 67 hours total, and we've had 64 volunteers helping us. Can you imagine having to pull all of this food by myself? So this is really thanks to the volunteers that help this project happen. So we had all those pounds of food, but we need to think about how to create meals for the community. So if you're thinking about it in terms of meals, we've had over 22,000 meals. And we are going to continue until we are all out of food. There are more pallets of food you can see stacked behind us. I think we had 12 or 13 deliveries that day. So much food. Different canned options, some condiments. We don't force people to just take whatever we have available. We respect different ethnic cultures, allergies, food sensitivities, religious preferences. We take that all into consideration to make sure that you are getting food that matches your needs. We don't pre-pack boxes. We let you pick what you want to eat. This is actually my favorite picture of Kat. You see the truck in the background, and it's full of food. People were there unloading, and that's what we do on Thursdays. Salads, fresh fruits and vegetables, some apples. Getting this started was very tough. I had this idea quite a while back, and these two men here have been huge supporters. Without them, this could not have happened. So I just want to take this opportunity to thank them both for their support. Mitch Gruber is the Chief Impact Officer of FoodLink, and Anthony McCletchy is the Superintendent of RSD. And with their help, we have been able to get food at a significantly reduced cost. Anthony McCletchy is the Superintendent of Rochester School for the Deaf, and he has provided many resources for the community and has collaborated with us, allowing us to use the space on the campus, and so he has really enabled our program to thrive. If you have any other questions or you want to learn more about Rochester Deaf Kitchen, this is our website. And you'll be able to log in to our website, see the different information that we have there. And I will let Jason take it over again. That's the end of my presentation. Thank you so much. Okay. This is Jason. Hi, Zach. Thank you so much. Oh my gosh, that was a lot of information. Thank you so much for sharing your passion, your knowledge. Wow. Time just flew by over the past hour. We did post your website in the chat as well. And also, this presentation will be available later on the Partners in Deaf Health social media and also through the University of Michigan's website. So we will upload this video to both of those places at a later date. Thank you so much. This was wonderful. Yep. Zach says, thank you so much. Have a wonderful night. And Jason said, have a good night as well. Bye-bye.